ఇది పెద్దది, అత్యంత శక్తివంతమైనదని ఆటోమొబైల్ వర్గాలు తెలిపాయి. అపోలో హాస్పిటల్స్ ఆధ్వర్యంలో దేశవ్యాప్తంగా 300 షుగర్ క్లినిక్లను ఏర్పాటు చేయనున్నారు. ఇప్పటికే 52 షుగర్ క్లినిక్స్ ఉన్నాయని అపోలో షుగర్ సీఈఓ గగన్ భల్లా తెలిపారు. ఈ సందర్భంగా డయాబెటీస్ స్క్రీనింగ్ కోసం ప్రభుత్వం తీసుకునే చర్యలను ఆహ్వానించారు.
Apollo Sugar is in the area of managing diabetes and pre-diabetes in the country. We currently operate about 50 clinics across the country. I want to add that I welcome the government's moves that the government has announced both at the central government level and at Telangana and Andhra Pradesh level, that the government will be taking efforts for non-communicable diseases like diabetes to screen them in the community. I think this is a welcome move that the government is making. We are more than happy to work with the government in any capacity that they would like us to. In a public-private partnership model, we would welcome that. We've conducted on our own, as part of Apollo Sugar's efforts over the last 2 years, we've conducted about 5 lakh screenings, so 500 million screenings we have done in the community, where we've actually gone and screened individuals for diabetes. And we've picked up some worrisome trends. We picked up examples where, for example, in Andhra Pradesh and Telangana, the prevalence of diabetes is closer to 25%, meaning diabetes and pre-diabetes, 1 in 4 people in Andhra Pradesh and Hyderabad and Telangana, 1 in 4 of us either has diabetes or has pre-diabetes, which is a very alarming figure. And if you compare this with the national average is around 17-18% versus the 25%. What is even more worrisome is if you look at the data in Telangana and Andhra Pradesh, we've screened about 1 lakh people. We picked up that people who have a family history of diabetes, they are 3 times more likely to develop diabetes. So if, let's say, my brother is diabetic, given that I probably have a very similar lifestyle in terms of diet and exercise patterns, chances are that I'm 3 times more likely to develop diabetes. And this is actually a major problem. And we believe the government actually has to act on this area so that a city like Hyderabad, which is coming up in a very good way, a state like Telangana and Andhra Pradesh, both of which are coming up very well, they remain healthy and they remain productive. So to us, this is a very, very important priority, and we would welcome the opportunity to work with the government on these kinds of areas and initiatives. As Apollo Sugar, we are doing what we can in the community, but we'll continue to expand. Over the course of the next 3 years, we believe we should be operating in at least 300 facilities across the country, which will either be owned by Apollo Sugar or partnered by Apollo Sugar with other diabetologists and endocrinologists who are working in the community. Today we are at 50, and we believe it is our responsibility to contribute in this way so that diabetes care is easily accessible to everybody across the country. We are currently catering to about 200,000 patients that we are able to service in a year. We believe that we will like to get this number closer to 1 million diabetic patients in a year. This is something that we are already working on, and we would welcome the opportunity to grow this even more in partnership with the government. I think the last but not the least, my personal views on healthcare as part of the budget. I think we are very welcoming to what the government is doing, and we believe it is important that the government focuses on preventive care. Preventive care and primary care is a very important part of where the government will need to invest its resources in the healthcare budget so that they can control diseases early. Detection of diseases like diabetes and cancer is very important, because if they're detected early, they're diagnosed early and treated early, they're not only going to help the country stay healthy, they also reduce the burden of healthcare spend in the country, which is an important priority, because uncontrolled, this number is going to continue to grow at around 30%. And today the country is spending something like 1.5 lakh crores on diabetes alone. As a country, we spend about 1.5 lakh crores, which is almost 5 times the size of the healthcare budget today in the country. And if this number continues to grow at 30%, that is a very, very big number. So we believe that the government will need to focus on preventive care and primary care as part of the budget. We believe the government actually has some very good capabilities in digital India that we've seen in the last few months. We believe the technology capabilities can actually be an important part of how healthcare is delivered in this country. For example, the Aadhaar platform reaches out to millions and millions of citizens across the country. Maybe the Aadhaar platform can be combined with the primary and preventive care model so that more people can be cared through technology interventions. I think last we believe, and I personally believe, it would be good for the government to work in partnership with the industry through a public-private partnership model, because we as private industry are capable and we are helpful if we can work with